The minerals are the spark plugs of life. The hair analysis is the laboratory test. That's the portal to understanding each individual's mineral system and what needs to be addressed. And there are certain basic concepts and principles that need to be learned by not only professionals, but by lay people as a general approach to health education.
Hey guys, it's Judy from Nutrition with Judy. I hope you guys have been having a good week. For those of you that don't know me, my name is Judy Cho and I am a nutritional therapy practitioner. I have a private practice where I work with my clients to get to root cause healing. And oftentimes that is usually working on healing the gut and using a meat-based elimination diet. This episode is sponsored by Redmond Sea Salt. Redmond has a variety of products. They have salts, they have clay masks, they have tooth care, they have an array of products and even activewear that you can wear to support your low carb, ketogenic, and carnivore diet. I am a big fan of Redmond salt. I use it while I fast. I use it to even balance my minerals, as we are going to talk about in this conversation. Make sure to use the code NWJ at checkout to get a discount off your high quality mineral salts. Today, I am very excited. I am going to have you guys meet Dr. Rick Malter. He is an expert on everything to do with hair tissue minerals and just mineral balancing and all the different nutrition and nuances with vitamins and minerals and everything to do with minerals and the hair tissue mineral test. This is not just about the hair tissue mineral, but the importance of minerals and how it is so important to balance for optimal health. There are a lot of nuances that we get into in this conversation, but I highly recommend just getting a piece of paper and pen and taking some notes, because a lot of these interactions with these different minerals are so important to possibly finding why you may have a little bit of hypothyroid, or you're having adrenal fatigue, or why you're just not able to balance your electrolytes, and maybe why you may even need to take some minerals to balance your stress levels. Maybe it's a physiological thing rather than just a psychological thing. Stress management is so important, but you will see how also minerals have such a strong play into your adrenals. All right, I am going to let Dr. Rick Malter introduce himself. He is a wealth of knowledge. I totally admire his work, respect all the things he does, and you will see his professor side to him and just the ability to explain things in such a simplistic way. All right, let's get right into the interview. So hi, Dr. Rick Malter. Thank you so much for joining me today. I would love for you to introduce yourself and just explain a little bit about what you do.
Well, I'm Dr. Rick Malter, and I'm a retired clinical and school psychologist from Illinois. I earned my master's degree in human development psychology in 1964 from the University of Chicago. And then I went down to Champaign-Urbana to do a doctorate in educational and school psychology, which I earned and completed in 1971. And in 1969, I was able to already pass the clinical psychology licensing exam in Illinois. So I became a licensed clinical psychologist even before I got my doctorate. And then I worked as a school psychologist in schools for almost 10 years. And then I started my own private practice in the Chicago suburbs, and was doing basically psychological testing for kids with learning disabilities, ADD, and those types of problems. And I was also doing counseling and psychotherapy with a group of master's degree practitioners who were excellent therapists. And by 1980, though, I found myself being totally burned out. I was utterly exhausted, which is not a good condition for a psychologist to be in.
Right.
And my medical doctors were totally baffled about what was wrong with me. And I'd gone to a chiropractor who suggested I do a 6-hour glucose tolerance test. And the first blood draw at the beginning of the test showed a fasting blood sugar of 45.
Oh, wow.
And I am told that is extremely low, which helped to account for my exhaustion and brain fog. And then when they gave me the glucose, it shot up to the 160s. And over the next few hours came crashing down. The last blood draw was 35.
Oh,
And of
wow.
course, I had all of the classic headache, shakiness, and signs of reactive hypoglycemia. So I knew I had a blood sugar problem. Fortunately for me, I was the psychologist for a small outpatient clinic in the Chicago suburbs. There was an optometrist and a PhD educator who founded the clinic. And the PhD educator and I became close friends. And he saw what bad shape I was in. And he urged that I get a hair analysis, which they already were doing with kids in their clinic. And when he got the hair analysis results, he was stunned. He looked at the results and saw that my magnesium level was rock bottom low. And he put his thumb and forefinger close together and said, I'm that close to a heart attack.
Oh, wow.
Because he knew the research literature, especially by Dr. Mildred Seelig, studying stress, magnesium deficiency, and heart attacks. So he already knew that literature, and he saw how low my magnesium was. And that got my attention and got me going on supplements. And I've been obsessed with magnesium for the past 40, 41 years now. But it was a lifesaver for me, as it turned out. And I began talking a lot about my own experience. And locally here at networking groups, people were constantly hearing me talk about the importance of magnesium. So one time at a luncheon meeting, I got up to speak. And one of the ladies said, oh, here's Magnesium Man. So that resonated with me. So I went across town to a t-shirt shop, and they made me a Magnesium Man t-shirt with a big shield. Instead of an S in the middle of the shield, they put MG for magnesium.
Oh, that's funny.
And and so I've been talking about the importance of magnesium for 40 years,
Okay.
based on my own experience. But that got me interested in hair analysis. So I began flying down from Chicago to Phoenix to attend the seminars that Dr. Pollack and Dr. David Watts were giving at the Analytic Research Lab in Phoenix about their research on hair analysis. And that just amazed me what they had discovered about the importance of minerals, what showed up in hair analysis tests, and especially detecting key mineral deficiencies,
Right.
like magnesium deficiency. And at first, though, I thought it was a panacea. And then I came down to earth after the early excitement about learning the basics. And I realized it's much more complex than that.
Yeah.
And helping people replenish depleted minerals and rebalancing their minerals was a real challenge,
Right.
depending on their life circumstances. But one of the things I discovered very quickly was not only was the hair analysis a test of minerals related to medical conditions and physiology, but it also was a psychological test because it reflected the impact of stress on a person's health,
Right.
and in particular, the minerals.
Mhm.
So as a psychologist, I was very relieved to discover that I was not entering medical practice, but I was bringing medical practice into my domain of psychology.
That's fascinating. And I definitely need to have you on again about autism and, all that you've learned during that part of your profession. I didn't realize that when I was having you on for all the hair tissue mineral analysis. So I'll definitely have to ask you to come back on and, we can talk about all of that.
Well, this is a good starting point.
Yes.
Then we can add on a lot of other things later on.
Yes, I would love that. So let's talk a little bit about the hair tissue mineral test. So, the basics is that it gives a snapshot of what's going on within the cell for a few months. So how, there's a lot of blood work and even urine tests that you can get the your minerals, right? So magnesium levels, calcium, you could get it through urine tests, but you can also get it through blood. So, why should we believe that, I guess, the hair tissue mineral is maybe more accurate, or is it that all three are just good data sets? Like, what are your thoughts on that?
Well, all three are data sets,
Okay.
but they reflect different psychological and physiological phenomena.
Okay.
The blood is a transport medium,
Mm-hmm.
and the blood is also homeostatic. It has to maintain its components within very narrow ranges. Otherwise, people's health deteriorates. And so, for example, many women recognize that they have symptoms of hypothyroid.
Mm-hmm.
But in many cases, the blood tests don't fall in the range for a doctor to diagnose hypothyroid, yet the woman has these symptoms.
Right.
But the hair analysis has the ratio of calcium to potassium, which was designated by Drs. Eck and Watts over 40 years ago as the thyroid ratio. And when that ratio goes above the ideal ratio of 4.2 to 1 calcium to potassium, that's an indication of hypothyroid. And so the hair analysis very often confirms a condition of hypothyroid long before blood tests will.
Okay.
As far as urine goes, urine is a pathway of excretion.
Mm-hmm.
And a good example, the hair analysis very often will not show excessively high toxic metals like cadmium, mercury, lead, and aluminum as examples. Because when a person accumulates toxic metals or gets exposed, if they can't efficiently excrete the toxic metals, the wisdom of the body will have the body store the toxic metals and sequester the metals where they will do the least damage until the body is ready to safely and efficiently excrete the minerals. However, if a practitioner does a very aggressive detox and pulls out a lot of metal into the urine, for example, a lot of mercury or lead that shows up very high in the urine after these toxic metal challenges, that will show a large quantity of toxic metals compared to the hair.
Right.
But what organ do those toxic metals go through on their way to the urine? Do we want to have excessive loads of lead or mercury or cadmium going through the kidneys in large quantities?
Right.
So the hair analysis may not pick up the full amount of toxic metals, but it leads to a supplement and diet program, a nutrition program that will replenish energy, open up detox pathways so that the wisdom of the body will know when conditions are ripe to release the toxic metals and in safe quantities. So it goes through several stages of detox.
Is that why sometimes when minerals become balanced, the second test shows a higher increase in the detox metals?
Exactly, because they're finally being released and excreted.
Okay. So, this is a little off topic, but I want to ask this from what you're just saying. So is most of the toxins stored in the fat? And then what would you say is the best way to detox these heavy metals then?
It depends on which metal you're talking about.
Okay.
With lead, calcium antagonizes lead.
Okay.
With excess copper, which is at epidemic levels, and we'll get into that when we get into copper toxicity.
Yeah.
Then with copper toxicity, zinc, manganese, and vitamin C are primary nutrients that will help to move these amounts of excess copper out of the cell and tissue storage to be excreted. And zinc is needed for excreting cadmium.
What about mercury?
Mercury, the same things that help to excrete copper
Okay.
will work for mercury too.
Okay, that makes sense. So in the hair tissue mineral test, they basically group people into slow metabolizers and fast metabolizers. Can you talk a little bit about, what does that mean?
Okay, that's based on the early work of Dr. George Watson, who was a psychologist. I think he was at the University of Southern California. And he was interested in studying the nutrition connection with psychological issues. And this was before hair analysis got established. So he was using some very complex blood results to determine fast and slow oxidizers, because he found that the nutritional needs of each oxidation type were different. And so it was useful for him to identify whether the individual was a fast or a slow oxidizer, and then give an appropriate supplement and diet program. And so he published his book, Nutrition in the Mind, in 1972. So we're talking about research going back close to 50 years or more. And Dr. Eck and Dr. Watts, when they launched their research into hair analysis in Phoenix, they were aware of Dr. Watson's work on oxidation types. And Eck and Watts very quickly were able to see two distinct patterns in hair analysis test results that they designated the fast or slow oxidizer. And that's how the oxidation type came to be incorporated into hair analysis data.
So I have seen some clients where they may be a fast metabolizer and then in a second test, they're a slow metabolizer. So is that common? So are you able to switch your, the metabolic rates in a sense?
Yeah, because the mineral system is a dynamic system and it's closely related to the neuroendocrine system, the sympathetic and parasympathetic. And the endocrine system, primarily the adrenals and the thyroid. And it also involves glucose regulation with the calcium-magnesium ratio.
Okay, that makes sense. So I have seen that majority of my clients are slow metabolizers. Is that because of our modern day lifestyle, or are we really just kind of wired? And I know you just said it's dynamic, but what are your thoughts on why many of us are slow metabolizers, meaning it takes longer for us to digest and, maybe we produce even less thyroid and even sex hormones? Your thoughts on that?
That the mineral system in the population has drastically changed in the last at least 50 or 60 years or more. Okay. To give you an example, my mother was born in 1906. And so she had my older brother in 1935 and me in 1937. So her generation were still fast oxidizers. And her age group never used the birth control pill or the copper IUD.
Makes sense.
So her generation tended to remain fast oxidizers till the day she died at age 90. You rarely see women who are not slow oxidizers as they age. And we can trace it back primarily to the effect of couple things. Primarily the female contraceptives, the estrogen in the birth control pill is closely related to copper. And one of the effects of the pill was to raise the copper level in the teenage girl or young woman. And as the copper levels went up, excess copper stored in the liver and in the brain is the primary locations. And as the excess copper built up, it slowed metabolism from fast oxidation to slow because it lowered the hair analysis cellular potassium. And as the potassium dropped, calcium also went up. So you had higher and higher calcium potassium thyroid ratios. And Dr. Watts at the Trace Element Lab just north of you in Dallas tells me that approximately 80% of the hair samples they run are copper toxic slow oxidizers.
That makes sense. So I send most of my labs to Trace Elements, and it's interesting because most of my clients eat a very meat-heavy diet. They eat a lot of beef liver, and beef liver is very high in copper levels, and then they're also slow metabolizers. So it's interesting because we think of beef liver to be very nutrient dense, but it's actually 3 ounces has over 1,000% of your daily value in copper levels. And then,
which is not going to be good for these slow oxidizers until they speed up.
I agree. So, yes, I agree. So I always say chicken liver is a better option because there is nowhere near, I think it's like 50% of copper for 3.5 ounces. So it's the daily value is much lower and it's much better. So my one question I have with what you just brought up is, so if my mom never used contraceptives and I never did, that what you just brought up almost doesn't kind of fall with us, but I haven't actually tested myself yet, but I'm guessing I'm a slow metabolizer as well, just from all the symptoms. So why did that happen to me then? And
well, it could be that you have a tendency to be estrogen dominant.
Okay. And don't you think that has a little bit to do with food though? Would you say that has a lot to do with diet, or is that actually just?
Well, diet is going to affect the mineral system.
Yeah.
But I don't think diet alone can account for the epidemic of copper toxicity and slow oxidizers that we see. I think it's much more plausible to look at the female contraceptives.
So interesting. Okay. We will talk a little bit more about the copper contraceptives in a second. You know, why I really wanted to bring you on here is because I have so many clients where, you know, the sodium potassium ratio is really low, and it's all the signs of low thyroid function, low or hypothyroid, or low where their adrenals are fully taxed, their sodium magnesium is really, really low. And so the question becomes, from the test, like, we know what is going on, we don't know exactly why. And that's the part that drives me crazy about the test, because I know that maybe there's some stress in their lives, maybe they're not eating enough salt. But the question is, you know, when we see, for example, that somebody's sodium levels are kind of low, does it really mean that they need to be adding more salt? Or is it that they're adrenally really stressed and there's like an imbalance with their aldosterone levels where it's not functioning as well? Like, how do we know what to do from here, kind of thing?
Well, Eck and Watts already knew the connection between adrenal activity and adrenal hormones, including aldosterone, and that aldosterone was the adrenal raising hormone.
Right.
So when they would see a very low sodium in the hair analysis, they knew the person is in adrenal insufficiency or adrenal fatigue and insufficient production of aldosterone.
Okay, so then for some of my clients that have those markers, I'll have them add salt or sole water, where they basically drink mineral water. But they don't feel as good. So
when they're raising the
sodium levels
sodium.
in their adrenals are showing just, an imbalance, or it's just really low. So why do they, just some people just react poorly to salt. And they say, oh, my legs are swelling because the aldosterone is, holding on to more salt. So
if they haven't raised their potassium along with the sodium, they'll wind up with a high sodium potassium stress ratio,
okay,
which includes inflammation
okay,
and water retention.
It's
That's very simple.
Right. But here's the other thing. So, if you are chronically low with sodium and magnesium, sodium and potassium, and then you were to, let's say, supplement magnesium because your magnesium is low. But if you were to supplement magnesium, they counteract each other. So then your sodium potassium could get even lower.
Yeah. So what you have to do is balance the sodium with the magnesium. And because the mineral system is dynamic, this may need to be adjusted literally from day to day.
Okay.
And in some people, the balances are very, very delicate and sensitive.
Yeah. Yeah.
And so I encourage people to maintain a high level of awareness of their reactions and to be flexible. Mm. So as you know, the hair analysis labs can offer a printout, a report of the test results and an explanation and supplement recommendations.
Yes.
And I remind my clients that the supplement recommendations are not written in stone.
Right, right.
They're general guidelines. And you can be very flexible in increasing or decreasing the doses and combinations depending on the individual reactions.
Yeah, yes, and I fully agree. So I believe that a lot of our minerals can be obtained from our foods, especially if we are having good stomach acid and digestion, and then we hopefully can get some more. So I normally give my clients the report, but even with the report, a lot of times it's like a plug and play, right? So they'll say your calcium levels are high, so therefore you should cut some dairy. But what if their calcium is high just because they're not as balanced with the magnesium, and I forgot what other markers kind of balance the calcium?
Potassium.
Okay, so so in that scenario, if your calcium is high, I mean, do we know to lower the calcium, or is it to increase the potassium?
Well, definitely to increase the potassium, along with vitamin A as the synergist.
Okay.
And taking into account that vitamin D lowers potassium.
Right, right. And the other thing I saw was that with vitamin D and magnesium, there's this like tricky balance as well, right? So from the preliminary research I've done, if you don't have enough magnesium, you may not even absorb some of your vitamin D. But I've also worked with other practitioners that have said, even if they supplement a lot of magnesium with their clients, on the hair tissue mineral test, their markers look okay, but the person doesn't feel, I think it's that the person feels better, but from a hair tissue, they're still not really absorbing it. So have you seen that in your practice at all?
Well, what we need to keep in mind is that potassium and magnesium are the primary intracellular minerals.
Right, right.
And when people are deficient to a significant degree in potassium and or magnesium, it's going to take quite a while to replenish those minerals and build up the intracellular reserves.
Okay.
But while they're doing that, they can be getting a daily benefit from increasing those minerals. So they may be feeling better before it's going to finally show up in a hair analysis retest.
Okay. So that makes a lot of sense. From your just general experience with your patients and clients, what has been the general recommendation for most of us being slow metabolizers? Do you recommend most people supplement magnesium? I mean, it sounds like magnesium, yes, but like potassium, like where do you stand with salt, and like mineral salts?
Mineral salts are very good. The adrenal cocktail can be very helpful, as well as the adrenal glandulars.
Mhm.
But the adrenal glandulars can be having a very strong impact on certain people,
Yes, I've seen that.
where they react very strongly. Their sodium starts going up, and they accelerate their magnesium burn rate. So if they're on adrenal glandulars, especially depending on the magnitude of their calcium magnesium ratio, the higher that is, the more deficient they are in magnesium, and the more sensitive they will be to increasing sodium
Right.
via adrenal support.
Okay.
This is the complexity
Yeah, I
of the
know.
dynamic mineral system.
Right. And so there was a different HTMA test company where I think they were just recommending certain supplements and people were buying it. And then one of my clients was not sure if she should be taking. So one of the recommendations was to take all this excess copper, and she was concerned. And so she started working with me again. And I just knew it wasn't as simple as, okay, you're low in sodium, so therefore take sodium. You're low in this, take this. But it's also the lifestyle changes and all that stuff. So,
Right.
but even from you, it sounds like from a day to day, it could be different, right? So I have some people, like you mentioned, they'll take the glandulars and they feel amazing, right? So their adrenals are starting to work a little better. But then some people take the glandulars and it's way too much for them. And
Right, then they got to cut back.
yeah. And so
That's where the flexibility comes in.
okay. So in general, if we, for the audience, I'm sure they're getting a little overwhelmed, but so what would be your kind of, and I know, again, it's flexible, everyone's different, we can be slow or fast, but in general, what have you seen to benefit most people that get the results of the HTMA?
Well, it of course depends on whether they're fast or slow metabolizers.
So assuming they're slow, since it sounds like most of us, and from the many that I've seen, I'd say majority of my clients, I think 80% are at least slow, and they're slow one.
Well, and it depends on how copper toxic they are,
Okay.
how many other toxic metals are stored in their system, how long they've been in burnout, and whether they were actually born copper toxic.
So how would we know that?
By taking a history.
Hmm.
That's why I'm not a big fan of doing blind analyses. Just taking somebody's hair analysis, looking at it and saying, oh, this is what it shows here, here, and here. Take this. You've got to tailor it to each individual's situation and personal history.
Yeah. And I fully agree. So I actually on my web shop, I sell the hair tissue test, but with it, I give them a full interview questionnaire about their history, what supplements they're taking, if they've been breastfed, if they've been vaginal birth and everything. So that it's not just this siloed questionnaire of the hair tissue. And then it's like, oh, you need calcium, because without knowing their stress levels, and that's a questionnaire, that's a question in my questionnaire as well. So I'm fully on board with that. If you are interested in the HTMA test, the hair tissue mineral test, I do offer that as a service. You can either do one with a consultation with me, but all of my reports provide the back end details of what all the slow and fast metabolizer means, what different minerals may mean, and what it may be indicating in your overall health. Some people are able to just read that on their own and be able to kind of work on what can improve their overall mineral balance. But some people then want to work with me, and there is a separate fee for that. So I definitely recommend, if you are eating a meat-based diet and you are not feeling 100%, no matter whether you add salt or not salt, or you add potassium or magnesium or what have you, and you're still not doing well with your energies or your sleep, and you're even eating the high fat and none of that's working, it may be time for you to examine if you want to do the hair tissue mineral test. And I think it makes a lot of sense. How often do you use the recommendations from the kind of report for the supplementation?
If a person is a garden variety slow oxidizer, then I'll usually go along with the TEI recommendations, or if they're a fast oxidizer. But there are some problems with the categories of fast and slow.
Okay.
So, for example, what TEI designates as a fast metabolic type 4 is really got characteristics of a slow.
Yeah.
But the lab's report will print out supplement recommendations for a fast only.
Interesting. Okay.
Whereas they need adrenal and thyroid support, even though they're designated a fast based on the C8 to P ratio.
That makes sense. I did notice that the slow one and fast 4 were very similar in terms of their markers, but
Yeah.
I don't really follow the supplementation, so I just kind of ignore all of that, but I should probably take a closer look going forward.
Well, you can use those as general guidelines, but I almost always modify the dosage.
Okay.
And I usually recommend start slowly with maybe just 1 to 3 supplements a day for the first few days, see how the person responds.
What do you think about diet in terms of all of this? So I know we're trying to modify the minerals with supplementation, but I mean, where do you stand with the diet and maybe how the diet can actually, like you just brought up vitamin A being, can have a cause in some of this mineral balancing. So what if we just changed our diet in ways that we are not eating certain minerals more so than others, and other like carbohydrates will kind of bind to some of the magnesium. So what if we just change some of our diet? I mean, do you think?
Well, diet is going to be helpful to a certain extent.
Okay.
But the foods in our diet have such a wide range of nutrients, and they vary depending on where they're grown.
That's true. That is true.
And in the condition of the soil. So we can't depend on diet alone to rebalance and replenish the minerals. So that's why a combination of fine-tuning the diet and fine-tuning supplements to the current mineral pattern
Okay.
is the best way to go.
That's really fair. I think that makes a lot of sense because I just interviewed a different doctor and he was saying that in his area in Michigan, they have a lot of selenium. So they never need to supplement selenium in his area. So I can see how that varies. So let's talk a little bit about the copper danger. So you brought up IUD. I know that on the report, it also talks about pipes. If you're a swimmer, if you're exposed to just like copper materials. And then in our meat-based heavy community, there is just a ton of copper in beef liver. So, what are your thoughts on how it has a relationship with estrogen?
Yeah, well, I recommend that slow oxidizers, if they're going to eat meat and use HCl for digestion, that they stick to non-liver sources of beef, or in the case of chicken.
Okay.
That they're not ready for heavy copper loads in their diet.
And what would be some symptoms you would feel if you were having high copper?
Okay, have you looked at the hair analysis page on my website?
Oh, on your website? I probably did, but I don't remember off the top of my... I do know some of the symptoms. I'm asking for the community.
Okay. Well, I provide a link to a list of symptoms.
And I'll put that in our show notes too.
So they can click on the link on my hair analysis page on malterinstitute.org, our website. And that will give them about 31 symptoms, physical and psychological, that are closely related to copper toxicity. The more symptoms they have, the more likely they are copper toxic.
Okay.
And those symptoms can increase or diminish depending on what's happening in their lifestyle. if they're continuing to use the birth control pill or having a copper IUD inserted, chances are their symptoms are going to continue to get worse. Whereas as they detox copper, then over time, the number and intensity of the symptoms are likely to diminish.
So do you think that that copper is best, I guess, seen as a result from your hair tissue versus, because they also have copper in your blood work. Do you think the most representative sample of the copper in your body is in the hair tissue?
Well, not only reflecting copper in the body, but also the impact of copper toxicity on the overall mineral system, namely creating a slow oxidizer, a mineral pattern with the high calcium, low potassium, low sodium.
So
and then you want to also look at the calcium magnesium ratio.
Okay. And that's I'm trying to look at the notes. That's the blood sugar balance, right?
Right. And also, over the years, I've seen that the calcium magnesium ratio correlates with alcoholism. And so I refer to it not only as the blood sugar ratio, but the addiction and alcoholism ratio and the codependency ratio.
Codependency on alcohol specifically, or on
No, the person who enables the alcoholic or addict.
Got it. Okay.
Is the codependent in addiction terminology. And they usually run a high cal-mag ratio as well as their partner.
Okay.
And the cal-mag ratio will reflect addiction and alcoholism. And to the extent that you can reduce the magnitude of the cal-mag ratio, that will support recovery and sobriety. If they don't address that, they'll continue to struggle to sober up.
And that makes sense even from a nutritional perspective, because your body will use the sugars from alcohol first and process it before even blood sugar, before sugars, and then from proteins and the gluconeogenesis from that. So I can see the logic in that. But that is a very interesting perspective. So what would you say, so for everyone that I guess uses the contraceptives, it sounds like you're saying don't do that.
Well,
ideally.
We know there's a strong connection between the contraceptives producing copper toxicity or exacerbating it.
Okay.
Okay. I haven't seen any studies utilizing hair analysis data to monitor what will happen to a female using the contraceptives, but also including zinc, manganese, and vitamin C to control and regulate the copper buildup or even to diminish it. And I'm not sure if they take those nutrients, will that offset the contraceptive effect of the pill or the IUD?
Interesting.
So they haven't done that research yet.
Yeah, I have seen the research in terms of the IUDs and these birth control pills affecting the copper levels in women and then the moods and all that. So I have definitely seen that, but that is interesting that if you were to offset copper with zinc. But one thing I remember researching when I wrote my book is that if you take zinc for too long, it's not also ideal. So, let's say your copper is high and so you think, okay, I'm just going to take a bunch of zinc and remove the copper foods, then maybe that can kind of counterbalance. But what are your thoughts on over supplementing zinc for long term?
Depends on what it does to the rest of the mineral pattern.
Okay.
Now, zinc will be important for retaining potassium and magnesium, as well as reducing copper.
Yes.
And Eck and Watts recognized 40 years ago that too much zinc lowering copper,
yes,
and bioavailable copper, could lead to problems with biounavailable copper and copper deficiency. You could have aneurysms. You could have a breakdown of electron transport, breakdown in energy production. And they found that chronic low copper levels in the hair analysis were good predictors of the development of malignancies.
Interesting. Okay.
So in the early 1980s, in their seminars and in their published information, they pointed out that chronically low copper in a hair analysis turned out to be an indicator of a higher risk for malignancies. But because of the sensitivity of discussing cancer, if you're not an MD or an oncologist, apparently somebody got to them and said, you better back off or they're going to put you out of business.
Got it.
And so they cut way back on discussing that. But in the early to mid 1980s, that was very clearly established in their hair analysis research.
What do you think of, and I don't know how much use you use with it, but what do you think of iodine with the thyroid?
I think it's very important.
Okay.
But I asked Dr. Watts about iodine and why he doesn't include it in the hair analysis. And he says he doesn't include it because technically it's very difficult to get a good measure of iodine.
Yes.
And so he doesn't want to include it in the hair analysis report, although he recognized the importance of it.
Okay.
But that's why he doesn't include it, whereas doctor's data includes it.
Oh, I didn't know that. Okay, that's interesting. And I think that's a fair assessment. From my understanding, the best way to measure iodine is to do take an excess load of it and then see how your urine kind of removes it from the body and see how much your body is using it. So do you think that there is a limit on how much iodine you can take and then how it can affect the thyroid? Or do you think?
Well, there's different opinions about that.
Yeah, no, I know.
Dr. Bronstein is a strong proponent of iodine. He says take up to 50 milligrams a day.
He was the one I was talking about that lives in Michigan, and selenium.
Oh, okay, yeah. Now, it's interesting. Michigan has high selenium. But I've read many years ago where Ohio, which is just below Michigan, has very low selenium and has higher cancer rates.
It's interesting.
So there were studies correlating selenium with cancer risks and the incidence of cancer.
Yeah, and he mentioned how, we do need selenium as a kind of cofactor for iodine, but he also talks about how without iodine, there are higher risks of breast cancer and somewhat of prostate cancer, but he's saying that it's more so the studies show in breast cancer and ovarian cancer. But then there's other people that, there's some more kind of standard care doctors or more mainstream that are very anti using iodine because they say it can cause hypothyroid. And Dr. Brown,
it could cause hypothyroid?
Yes, they're saying that too much iodine can cause hypothyroid. So Dr. Brownstein doesn't agree. And, we talked offline about specific doctors, but yeah. So it's just so I just wanted your take since you're doing so many of the minerals and since it's all really intertwined. So I was just curious. So
yeah. Well, when it comes to MDs, 40, 50 or more years ago, there were quite a number of MDs who were heavily into nutrition, heavily into the minerals. Dr. Henry Schroeder used the term, minerals are the spark plugs of life. I mean, he recognized how extremely important they are.
Yeah,
he's an MD.
No, and that totally makes sense. Even in our nutritional therapy school, that's how we were taught about minerals. We're like, without minerals, there's no spark plugs to even let things happen.
Yep.
And so it's so important. So would you say that in general with your patients or clients that they typically supplement sodium, magnesium, and potassium, or is it really just varies?
It'll vary to a certain extent, but in general, supplementing with the adrenal cocktail, if you don't have the hair analysis, and with some potassium and vitamin A, is very likely to give an energy boost to many people who are copper toxic slow oxidizers.
And when you say adrenal cocktail, what are you specifically talking about?
I'm talking primarily about making a little drink. A lot of people recommend using orange juice,
Okay.
putting a quarter to a half a teaspoon of cream of tartar for the potassium, and a quarter to half a teaspoon of sea salt, and then sipping that throughout the day.
Okay. Okay. So it's not just drinking it all at once.
Not unless you're going to be doing some intense activity, and
Okay.
you need that adrenal boost.
Got
So
it.
instead of drinking a cup of Starbucks or Dunkin' Donuts coffee, sip your or drink your adrenal cocktail, bearing in mind that if you drink it all at once and you shoot up your sodium temporarily, your magnesium's going to go down.
Right. That makes sense.
And so it's very important to be aware of what your magnesium status is. If it's rock bottom low, like mine was 40 years ago, continued coffee drinking or using a lot of salt could have thrown me into a heart attack.
What do you think of, so one thing I've seen with some of my clients is that they take like a cocktail and they're low carb dieters. So maybe you can talk a little bit about why low carb dieters seem to have a harder time balancing their electrolytes. But one thing I've seen is that they'll take a cocktail of magnesium and potassium and sodium, and they never, if they don't take it, the next day they just feel unwell. And then typically I'll have my clients then start taking some Soleil water. So they'll have the mineral water, like the Celtic salt, Redmond sea salt, Himalayan salt. They'll leave it overnight in the water. So then the water is fully saturated. And then they'll add that to a little bit of water. And then they find better balances. And then sometimes they use some magnesium topical spray or oil on their skin. And that's sometimes sufficient for them to feel better and have like a consistent balance instead of always having to take these supplementations. You know why that may be? Do you think they're getting enough minerals from the Soleil water?
Well, it sounds like they're getting adequate remineralization using that protocol and that approach. But again, it's biochemical individuality.
That's fair. No, I totally agree with you, but I'm just like in a general, just trying to get, I guess, like I don't think there is a blanket statement for hair tissue mineral. I think that's
we have to be careful about not overgeneralizing.
Right.
We have some basic principles that apply to most people in most situations, but you always fall back on biochemical individuality, and the psychological component is very, very important.
No, that makes a lot of sense. What are your thoughts about low salt diets? Because some people just don't feel good with salt and they just cut it out. But I wonder if maybe it's the mineral, like you're talking about with this whole balancing, maybe they're actually deficient in magnesium and it's not.
Yeah. So anytime they take salt and they're unaware of their magnesium status, any increase in sodium drops their low magnesium even lower, increases their CalMag. They spaz up, their blood sugar drops or fluctuates all over the place. Their moods change.
Right.
And it has a profound effect on them.
In terms of magnesium and potassium, are there forms that you prefer or recommend more? So do you think the magnesium spray is a possible better option than taking like magnesium citrate or the other magnesium forms? What are your thoughts on that?
Well, we've been using magnesium malate very extensively. And we use the trace element magnesium malate.
Okay.
And what Dr. Watts did is he recognized how many people have low magnesium or a high cal-mag ratio, and they also have low chromium,
Mm-hmm.
and they tend to be deficient in B6. So he put magnesium, B6, and chromium together into one tablet that he calls Minplex B. And that is an excellent combination for uh, supplying magnesium and its synergists.
That's interesting. I do see a lot of meat-based clients that are deficient in B vitamins, even though they eat a lot of meats.
Mm-hmm.
And B6 is one of them, B6 and B1.
Yeah.
That's the other one I see often. Why do you think that some people, when they are constipated, they take a lot of magnesium citrate or vitamin C and they have a bowel movement? Is it something about the citrate and not the magnesium? Is it
No, it's primarily the magnesium.
okay? So what is it about that I guess makes you go?
Well, it's been known for years that magnesium helps loosen the bowels. But then you can go to the other extreme of too much magnesium and you go from constipation to loose bowels.
Right, right.
So when you hit bowel tolerance like that, then your body's telling you you have enough magnesium for that particular day, cut back.
But do you think that using magnesium to just have a bowel movement is a bit of a band-aid? Or is it that they're really deficient?
Well, if they've got a serious constipation problem, they need magnesium
Yeah, that makes sense.
because they've got to get themselves more regular and get rid of those toxins in the bowel.
Okay. What about potassium? What form of potassium do you think is, what's the one that you use most often?
We use the one in the trace element, potassium with vitamin A.
Okay. Okay, I'll have to take a look at that. Okay. Do you see a lot of people needing to supplement potassium? Because I actually don't recommend my clients supplementing potassium just because, you can overdose on that. You can, especially when you're starting a low carb diet. I know of some people that have landed in the hospital for over supplementing potassium, and
Depends on how much potassium they were taking.
I think it was just, I don't know for sure. So I can't say, but and they use it for like lethal injections and stuff. And so there's a little bit of like fear of like over supplementing potassium, and, sodium, potassium are on a natural pump. So I just figured if you can manage the sodium, then it'll self-regulate the potassium that's within the cell.
Mm-hmm. Well, that's why with the hair analysis balancing supplement program, it's best to start off slowly and with low doses and see how the person responds. You can always begin to bump it up a bit once you have the person started and seeing how they're responding. But if they start with the doses that the lab report recommends, to me, that looks like way too much to start with.
Got it. Okay. And when they are doing, when you say that they, you'll have to see how they're doing, do you mean that they'll start feeling like a little bit more energy? I mean, what are some of the, I guess, the benefits of, once you start balancing your minerals, just things are working better?
The primary one would be a pickup in energy.
Okay.
Because so many of these slow oxidizers with very low sodium and potassium, for them it's like having a drained battery. And instead of a jump start that, for example, a powerful stimulant drug might give them,
Right.
it's best to recharge their drained battery slowly, like you would do if your battery is truly drained. You have a mechanic slowly recharge it overnight. Then a jump start is not going to do the trick. As soon as you stop the car, you're drained again.
Okay. And that makes a lot of sense. So in your practice, have you seen that most people should take this test Do you think it's more for people that seem to struggle with adrenal insufficiencies and thyroid, hypothyroid? What are your thoughts about that?
Well, the more people understand the mineral system and the wisdom of Dr. Schroeder, that these minerals are the spark plugs of life, and the hair analysis is the portal to the mineral system. It's reflecting your minerals.
Right.
And the minerals do not deposit randomly in the hair follicle. The mineral deposition is driven by stress, energy levels, diet, drugs and medications, herbs, what we drink. Medications have a powerful impact on the mineral system. And if you listen closely to drug ads on TV, most of the side effects sound like they're magnesium loss symptoms.
Mm.
So many of these drugs are depleting people's minerals.
No, I believe that.
Especially magnesium.
They also deplete a lot of the vitamins.
Yeah.
I firmly believe that. In terms of stress, I know that, so one of the supplement companies I work with, they have like a glandular support, and they don't use, this one is much more mild. So for the adrenals, they have a little bit of taurine, a little bit of vitamin C. So in terms of stress, I mean, how much does it affect our minerals? So, like, let's say in a perfect world, I have a really stressful job and there's nothing I can do about my lifestyle. So I try the meditation, tapping, breathing, all of this stuff that is supposed to help reduce stress. But the actual stress point, I can't fix it. But I take all the supplementation, the minerals, I clean up my diet, but will I still suffer from the stress causing the root cause of my stress?
Well, the hair analysis will reflect back to the person how their system is being impacted by the stress.
But what if I just supplement?
The hair analysis will tell you if the supplements are working for you.
Okay.
And if you need to tweak the supplements.
Well, what have you seen with people that are that are highly stressed individuals or live a stressful life, and even if they're supplementing and doing everything else right?
That the supplements can help take the edge off of the stress.
Okay.
It's not going to take them out of the stressful situation or the stressful relationship.
But will their HTMA minerals kind of look, I'm sure that it'll improve, but can it improve to like normal levels if the stress doesn't go away?
Very unlikely.
Okay.
Because stress will continue to take a toll on magnesium and zinc. So just looking at this past year with all the COVID hype,
yeah,
and the fear and the stress that has been constantly induced and reinforced, you can bet there's a lot more people walking around with magnesium and zinc deficiency.
I believe it.
And with the zinc deficiency, what's that going to do to their copper toxic condition?
Right.
As they lose zinc.
Like, that is a good question. So if you don't consume any more copper, will it just kind of keep it at the same levels, or well, without the zinc, it just won't displace the copper?
Well, you won't have the zinc to help to displace the copper, and you won't have enough zinc to counteract the adverse symptom effects of the copper.
And you won't, without zinc, you don't really produce a lot of hydrochloric acid to break down foods.
Right.
So
with the hair analysis concepts and understanding the mineral system and how these lifestyle factors impact minerals, that's going to be a problem.
What about sleep? Some of my clients will take a little bit of magnesium spray before night, and they'll their body feels a little bit more relaxed, like an Epsom salt bath, for example. And some people, the magnesium actually gives them a little boost of energy and they can't sleep. And same thing with the salt. What are your thoughts? We have an epidemic of people not being able to sleep a lot. Some of
Yeah.
it's the blood sugar imbalances with the cortisol, the hypoglycemic response, that type of stuff. But other than that, do you think it has anything to do with the minerals?
Yeah, I think it has a lot to do with the copper toxicity in the
Oh,
brain that keeps their thoughts and their thinking overactive even when they're physically exhausted. That's why on my website, on the hair analysis page, I have an illustration showing a person physically exhausted with their head down on their desk and another figure just racing. That's the mind racing and the body exhausted. That's a classic copper toxicity syndrome.
wow. So do you think in those situations, no amount of like breathing and, like meditation?
I recommend breathing, and I recommend taking in adequate oxygen, which is one reason why I oppose all of this mask wearing.
Although people say that it doesn't lower your oxygen, but now they're going to do double mask and triple mask. So,
Oh, that should be wonderful. Yeah, do you know who Dr. Russell Blaylock is?
no, I don't.
Blaylock is a retired neurosurgeon
Okay.
who retired about 20 years ago. And he's got a wonderful wellness newsletter. And being a neurosurgeon, he knows something about wearing a mask. And he knows wearing a mask is going to cut down your oxygen intake. So he strongly recommends not wearing masks.
I know. And it's so unfortunate that a lot of students or young kids are going to school for 8 hours a day wearing
Masks.
the entire.
That's insane. That's insane.
It's one of the reasons I didn't send my kids to school.
Yeah.
Of many. Let's talk a little bit about your book. So you have a hair mineral book. What else? What other resources do you have that if people want to learn about this, the hair tissue mineral, just minerals in general, like where can they find you and all your information?
Okay, well, my book I wrote and published almost 20 years ago when I first retired. And I had a few extra hours on hand. And the book is still very valid and applicable. I've added a few more things to some of my PowerPoints that I use in my hair analysis training classes. And I originally set up the training classes for healthcare professionals. But the more I've thought about it, people need to get educated about nutrition in general and minerals in particular. And so reading a book like mine and taking some of my classes and seminars is a good way to get up to speed in understanding the basic concepts and principles for understanding minerals, the mineral system, and the hair analysis, so that people can then be more responsible for their own health, their own nutrition, and keep themselves at a more optimal condition.
And I fully agree with you. I think the one thing that just is so hard for me to wrap my head around the minerals is there are so many different antagonists, supports, and I mean, it seems like your the few that we brought up with copper and sodium, magnesium, potassium, there's a few markers, but it seems like it's so hard to figure out what exactly is the right balance. And without doing a ton of testing or, managing different supplements, it just seems pretty hard to manage these minerals. And then couple that with, it could be life stressors. And, sometimes our body is in a sympathetic or stress state and we have no idea, right? So.
Right. But the hair analysis will reflect it.
Okay.
The body always knows.
No, that I agree. I 100% agree. I always tell my clients that are forcing down liver or foods that they don't want to eat and, they're forcing it down for nutrition. I'm like, your body is probably in a stress state eating that and it's affecting your digestion and you probably shouldn't do that. So I agree with that. Okay. So how long do you see somebody that has, like the sodium potassium is really low, the calcium potassium, and then the sodium magnesium is almost non-existent. Like how long does it take for those minerals to kind of balance from your experience?
Again, it's an individual situation, but the lower the sodium and potassium, usually the longer it's going to take.
Okay. What
Again,
about this?
again, it's like recharging a drained battery.
That makes sense. What about the sodium magnesium? Because that's the one I see really low on a lot of people.
That's telling you the adrenals are fatigued and exhausted.
No, I believe that. Yeah. So, but does that one take a little bit faster to be supported than the sodium potassium?
The sodium potassium is much more involved because
It's a
you have to be able to determine, is a low sodium potassium ratio a true inversion low ratio,
mm,
or is it being impacted by a loss of potassium from inside the cells, with all that potassium being excreted? Now, many years ago, Dr. Watts would have medical doctors run 24-hour urine samples. And quite often, that would show an elevation of potassium in the urine, reflecting the loss of potassium from the cells. So that would mean that the low sodium potassium ratio is a pseudo low ratio.
right.
And usually the person needs potassium to replenish what they're losing.
Okay. Yeah, and that's the biggest difficulty that I see with this test is I don't know if like you were talking about just perfectly with the sodium potassium is it truly a deficiency in the sodium or is it something is causing the potassium to get depleted?
Well, one thing I look at is the magnitude of the calcium level.
Mm.
The higher the calcium level, above the ideal of 42, the more likely it's triggering a loss of potassium, especially if the calcium magnesium ratio is also high.
Okay.
And if they're dumping copper and having an elevated copper or a low zinc copper ratio, or if they're taking a lot of vitamin D.
Let's talk about the vitamin D really quick. So
Yeah,
we have become a society where I feel like we've become a society where magnesium is something that's, I feel like sometimes we overly supplement. I know most people are deficient in magnesium. I do know that, but I do also think there's a lot of over supplementation of it. And then I also see, everyone, especially since this outbreak, vitamin D is kind of the godsend vitamin. But the vitamin D we are taking is a hormone. And so that's where I have a little bit of heartburn. There's a little bit of research that kind of goes every which way about vitamin D. And then there's even that, there's articles about how vitamin D will impact magnesium levels. So can you speak to a little bit about kind of your thoughts with magnesium, vitamin D, and should we be supplementing like 10,000 IUs, even if we're showing like lower ranges in our blood work for vitamin D?
well, I think Morley Robbins' article on it that he wrote back in 2014 is dead on target.
Oh, is it? Okay.
Yeah, I think he really nailed it. That a lot of these low measures of storage vitamin D, which is the primary one that's being measured,
Right.
is really reflecting magnesium deficiency. And if people did a hair analysis, they would see that many of these people are truly magnesium deficient, very often with a high cal-mag ratio. And the vitamin D is masking and covering up a significant magnesium deficiency.
Right. And I think also and I get all these balances confused sometimes, but also from what I remember, if you have sometimes the vitamin D, I think this was from Morley's article, but if the vitamin D is really low, that may be a reason so that the calcium will not go into the improper areas, right?
Right.
Like that. Okay.
Yeah, I think Morley nailed it.
Okay.
His article really covers it well.
That's awesome. So, but then this will go to my article that I wrote just about the magnesium, right? So if we saw that result with the vitamin D and we see the low magnesium and we're like, okay, so we need to supplement a lot of magnesium, but then we risk the levels of sodium and potassium if we're low, right?
That's why they need a hair analysis, see what the overall mineral pattern is.
Okay. So let's say we are low with magnesium and we are low with sodium. Actually, can it even be possible to do that? So if we are low in sodium and potassium, and then we're also low in magnesium, like how do you increase them when they are antagonists, essentially?
You approach it very delicately.
Okay.
And that's why encouraging a person to be aware of the sodium magnesium balance and the dynamic interplay between these two minerals. And you have to be flexible.
Okay.
And if you start increasing the sodium and picking up the adrenals, and the person starts to get tight spastic muscles, blood sugar fluctuations, and heart palpitations and AFib, then you better pay attention to the magnesium.
Okay. So I don't know if we fully answered the sleep question, but some of my clients in the middle of the night, they wake up with their heart racing. Thoughts?
A long time ago, Dr. Watts told me that when we sleep in the middle of the night, the adrenals can start to become active.
Yeah.
And so that's throwing the person into a higher Na to K stress ratio, with the heart starting to race, and it triggers a loss of magnesium.
So
and that's why some people can have heart attacks in the middle of the night.
So what would be your
magnesium deficient?
Yeah, and that makes sense because magnesium allows the muscle to relax. But so what would be your recommendation? Would that person have to supplement a little bit? Because if they get it every night, waking up with that heart kind of racing, should they be supplementing magnesium or should they be supplementing a little bit of potassium and sodium?
No, I would suggest supplementing magnesium.
Okay. And would you say like
because the potassium is too stimulating.
Okay.
And the sodium too.
Any foods that are high in potassium, other than that kind of tartar, I think there was some other food I'm forgetting that's a natural potassium. Oh, nettle teas are also really high in potassium. But is there any food that you recommend for potassium?
Coconut water.
Okay. Well, what about the sugar levels?
Depends on the cal-mac ratio and the magnesium status.
Okay.
So I'm constantly thinking of the broader mineral pattern and recognizing the minerals are vital, but they're dynamic and interrelated.
Yes.
So that's why educating people more about the mineral system is so important.
Yes. And I'm really glad I talked to you because sometimes I get these mineral tests back and I feel like I almost have a trend and then I see differences and I realize, I'm glad I talked to you because I realized it's okay that I feel like there's a lot of data because there really is a lot of data.
Yeah. And that's one of the problems with a lab test like trace elements, because originally Dr. Watts only had the top half of the first page, the nutrient elements and the toxic metals. But doctor's data has all kinds of toxic metals and all kinds of nutrient elements. And so a lot of doctors and health practitioners, in considering a hair analysis lab, would count the number of toxic metals and nutrient minerals in each lab's report. And they would go with doctor's data because they were getting more bang for their buck, regardless of whether you got a meaningful report from doctors' data. So they were just going on the basis of minerals. And
Right.
some of the minerals are more important than the other ones.
Yeah.
And so as a matter of competing in the hair analysis business field, Dr. Watts added the additional minerals.
Got it. Okay. And that's why there's all those toxic ratios right under, I guess on the second page, there's the significant ratios. And then, no, I think it's on the first page, the latter half, there's all these other numbers.
Yeah, for the additional minerals.
Okay. That makes sense.
And then the toxic ratios. And you'll notice the toxic ratios are set up where the protecting nutrient mineral is in the numerator.
Yes, I saw that.
And the toxic metal is in the denominator.
So do you think the significant ratios are more important than that first page of the individual? Because,
well, the ratios are very important.
right.
Eck and Watts were talking about the importance of the ratios 40 years ago.
Right.
But then if you have minerals like magnesium and or potassium that are lost under stress, and they're really excretion ratios, they have a different meaning than if the ratios are based on what's being retained in the cells.
Sure.
So
And
that's making it more complex.
yeah, and I think both, for me, it's been helpful to see both, because sometimes the ratios will show that, like your calcium, let's see, so your sodium, potassium will be really high, and it's maybe because the sodium, the individual marker is slightly higher than potassium, but they're still low from a individual marker. So that's why I thought it was helpful to have both. What I do find personally in my own life, whenever I have a bout of like just a momentary stressful moment, I notice my, I get like chest pains a little bit. And that's when I know I probably need more salt or magnesium.
Mm-hmm. Yeah. Well, you have that knowledge and awareness.
Yeah, I feel it immediately as soon as I like get in an argument with like my mom or something, and then I'll feel the chest tightness.
Yes.
And then sometimes I just spray the magnesium on my chest because I'm just like, I need it right now.
Does it help?
Yeah, I do feel like it does. That's why I'm a big fan of the magnesium spray. I feel like it bypasses the digestive process and goes straight into the bloodstream. Now, it's probably not enough if you are really magnesium depleted, but have you used magnesium?
Now, do you have Dr. Watt's book?
No, I actually don't. I think I've been in communication with him because I email trace elements occasionally, and I think he's the one that responds sometimes. I'm not, but no, I need to get his book.
Yeah, because his book was published around 1995 or 96.
Okay.
So in his book, at the beginning of the book, he gives an illustration of a TEI graph.
Okay.
And that illustration shows the original TEI graph with the ideal levels for calcium, magnesium, and all the minerals all the way across.
Okay.
Now, what happened around 1999 or 2000, during one of the federal inspections of the lab, whoever was the inspector on that particular inspection came up with the bright idea that Dr. Watts should update his norms
Oh, okay.
going into his database. So, knowing that about 80% of the HTMAs that the lab does are slow oxidizers, what do you think updating the norms did to the calcium level?
It increased it.
Yes, it jumped from 42 to 60.
Wow.
A 50% increase, which is what you would expect when you have a true understanding of HTMAs and the difference between fast and slows, and the difference in the proportion of fast and slows. And then he put in new equipment a year or so ago upgrading the laboratory equipment. And so he had to update again. What do you think happened to the upper end of the calcium range?
I'm assuming it went up again.
Yeah, went up from 97 to 104.
Wow.
And that, all that does is confirm that we have an epidemic of copper toxic slow. And it's normalizing calcification of people's bodies and tissues.
Do you think that a lot of this imbalance has a strong play from copper, or can a lot of this stuff be happening even without copper toxicity?
Well, some of it can happen without copper toxicity.
Okay.
Mercury, there's a lot of exposure to mercury with the dental amalgams,
Right.
contamination of fish, mercury getting burned off by coal plants, a lot of sources of toxins.
Okay. Well, this has been a very helpful, lots of information, but I think it gives me, as much as it's so complicated, I think it helps me at least personally understand a little bit more. Yeah, so I had very similar sentiments of coming into this of maybe Dr. Malter will just give me a straight over answer, and obviously I don't get it, but that's good. I think it's I fully agree that, you know, if anyone has ever seen the mineral wheel, it's so complicated. And so to say that, oh, this means this and you just need to supplement this or eat this food is not, it's overly or grossly simplified, and it could actually be not beneficial to the person that took the HTMA test. And that's where I think a lot of these practitioners that are just selling the test and then people are just supplementing whatever gaps they're seeing and not even considering their own symptoms, I think can be more dangerous, I guess. So I think this information is really helpful for people to understand the complexities of minerals.
Exactly.
Okay. Well, I'm going to have to definitely have you on and talk about, because I majored in psychology, so I'm a big fan of psychology therapy. And so we need to come on and talk.
Yeah, when you majored in psychology, what were they emphasizing in psychology at that time?
Well, we were able to study what aspect of psychology you wanted. And so I did a little bit of like child psychology and how, you know, like Freud and Carl Jung and all of that. And then but I like fell in love with social psychology. So I kind of focused more on that aspect of it. Mm-hmm. There was one part, the mental part of it, the kind of drug addiction side, that part I didn't like as much. I think it was the neurological psychology. I forget now, it's been such a long time, but it's so fascinating. So I went to UC Berkeley, and they have a lot of psychology studies out there, but I really enjoyed the social psychology aspect, and just about how so much of our interactions, proximity, cultural differences, how all of that affects how we perceive the world. And that was so fascinating to me back then.
Yeah. Well, one of my most recent PowerPoints I put together after watching a video of the making of Fiddler on the Roof.
Okay.
The composer, the lyricist, and how they put the whole thing together. And of course, that story was about this Jewish family in a small settlement in Russia.
Okay.
Where they were exposed constantly to pogroms and attacks, especially by the Tsar's army, mm-hmm. or the drunken Cossacks. So you can imagine the constant stress.
Right.
So that's what I call the Fiddler on the Roof syndrome. Mm. Whenever a person or group of people are subjected to unpredictable, constant stress and attacks.
Like now?
Yes. So that's why having the HTMA perspective helps us make sense out of how historical situations impact health overall by stress and the impact on the mineral system. And that's why in the Jewish community, you have very high rates of magnesium deficiency conditions, heart attacks, diabetes, and cancer. You can apply this to the experience of the African American community, Native Americans, and any groups that have been subjected to trauma, terror, and high stress.
And I see that in my own practice where some of my clients heal their gut, they heal, they change their diet so they're eating less processed foods, but they may have had trauma in their past, or they had a just stressful life or conditions currently. And so everything looks good on their blood work, stool test, like they get like a stool test sample where they show no pathogens, but then they do the hair tissue mineral test and it's not balanced.
Yeah.
So
because
see
the early trauma and stress impacted their cells and tissues very deep into the system. I'll give you an example. Many years ago, when we had our practice back in Chicago, we were doing marital counseling with a couple.
Okay.
And the woman happened to be from England. She had a delightful British accent, but she was just overwhelmed with anxiety. And no matter what we did on counseling and therapeutically or even nutritionally, she was still in a constant state of sympathetic dominance, very high anxiety and panic. So one day I asked her when she was born and where. She was born in 1940.
Oh, okay.
In London.
Mm.
Can you imagine what her mother was going through?
Right.
With the constant bombings of London, being pregnant. So that stress in the mother sensitized the fetus to constant exposure to adrenaline.
Wow. I never thought about that. Yeah, that's pretty.
Well, that's why I'm putting it. So that's why it's important to know what the conditions of the mother of the client was when the mother was pregnant with the person. Because one of my clients also used the term being marinated in his mother's adrenaline, because she was constantly stressed and angry. So I think some people become super sensitized to stress and adrenaline reactions, which means they'll struggle to retain magnesium.
So then would that naturally cause them to keep a lot of excess copper in their bodies compared to like another person?
Possibly, sure. Because then they're also losing magnesium, losing zinc.
Mm-hmm. Okay. This is so fascinating. I'm definitely going to put the notes of your book, your program, your institute, and then also Dr. Watts's book and all the HTMA information. It's so much information, but I think it's wonderful and it's really helpful because I focus on gut health and changing the diet, but it's very holistic. And one thing I'm seeing is that as people heal, they heal a lot. But the one lever they can't seem to change is the stress aspect. And I think it's because the minerals are imbalanced.
Mm-hmm.
And I tell them, do all these things to relieve their stress. And they're like, I'm trying. But I think they just, maybe it's just physiologically, they can't change as much of the stress until they work on some of the minerals in the body.
Yeah. Did you look at our webpage description of our books?
No, so I have this book, which I thought was really helpful, but I'll have to look at that and then I'll put the links in your notes.
Because we wrote a book on what we call the psychological judge or inner tyrant.
Okay. I'll have to look at that.
And that's more meaningful than Freud's superego.
Really? Okay.
And is much more related to Jungian psychology.
Okay. Yeah, I learned about Johann too. I do remember that now.
Yeah. And so We have an ebook, How to Free the Inner Child,
Mhm.
from the psychological judge. And the more stressed a person is, the more their psychological judge will inflate
Mm.
and take over their psyche and their mind-body stress response. And that could be one of the things that makes it difficult for people to get past their stress situation.
Yeah, and then if you consider what's all going on now, it's everyone is already stressed, and then we're eating foods that are mineral depleted, and
Yep.
we're not managing our minerals, and it's just a lose-lose situation. So, and
Yep.
then we're wearing masks that, like you said, even stop more oxygen on top of a stressed body, right? So Dr. Malter, thank you so much for joining me, but what would you say in terms of, this whole conversation about hair tissues? I'm sure some people will say, well, there is so much to know about minerals. I don't even know where to start. What is your take? If people, just like the average person is watching this, I'm sure you'll say take the hair tissue mineral test, but what are your kind of general recommendations about lifestyle, hair tissue, minerals, what have you?
Well, I come back to Dr. Schroeder. The minerals are the spark plugs of life. The hair analysis is the laboratory test that's the portal to understanding each individual's mineral system and what needs to be addressed. And there's certain basic concepts and principles that need to be learned by not only professionals, but by lay people
Right.
as a general approach to health education.
I
The
agree.
mineral system and the HTMA hit the nutrition bullseye. So many of these other approaches may hit the target, but they hit the outer rings. If you picture a Target logo on a Target store. So if you hit the outer rings, you wind up going round and round in circles, whereas the HTMA hits the bullseye.
Makes sense.
And getting educated and understanding more and more of this is vital.
Well, thank you so much.
Well, it's been a pleasure meeting you and talking with you about
yes,
this.
same with me. It's been an honor. I think the minerals are so important. Even in our schooling, it was one of the root cause foundations of why health can become worse over time. So I think it's such an important part, and I've definitely learned so much from you. And I'm sure the people listening and watching are learning a lot. So thank you.
Okay.
And I will put all your information again in the show notes. So thank you again. And we will have to have you on again soon and talk about the psychology of like autism and all these other areas that you are specializing in.
Okay, sounds good.
Okay, thank you.
Have a good evening. Bye-bye.
All right, guys, I hope that you enjoyed this conversation. It was such an important one. I know there are so many nuances to minerals, but like he said to me offline, don't get so flustered. Don't get so focused on every little nuance, but learn about the importance of minerals. And if you are feeling deficiencies, you can always get a hair tissue test and figure out what is going on. I am still a big proponent of the Soleil water. I think it helps to address a lot of the adrenal issues, but maybe we do need a little bit more magnesium or potassium. It is very bio-individual, and that is something that Dr. Rick Malter emphasizes so much, but everything is so bio-individual, and you see that in the conversation with Dr. Rick Malter. He overly emphasizes that throughout our whole conversation. If you are interested in the HTMA test, the hair tissue mineral test, I do offer that as a service. You can either do one with a consultation with me, but all of my reports provide the back end details of what all the slow and fast metabolizer means, what different minerals may mean, and what it may be indicating in your overall health. Some people are able to just read that on their own and be able to kind of work on what can improve their overall mineral balance. But some people then want to work with me, and there is a separate fee for that. So I definitely recommend, if you are eating a meat-based diet and you are not feeling 100%, no matter whether you add salt or not salt, or you add potassium or magnesium or what have you, and you're still not doing well with your energies or your sleep, and you're even eating the high fat and none of that's working, it may be time for you to examine if you want to do the hair tissue mineral test. All right, guys, you know the drill. Make sure to eat a lot of meat, take care of your bodies because it is the only place you have to live. Take care, guys. I will talk to you soon. Bye.